Good evening. I was thinking, being a non-medico, this will be really change of gears. But our previous speaker was really very different, professor of mathematics, and we can see that cancer is so heterogeneous that anything can fit in, right? Any topic. So thank you very much, organizers, for noticing our recent case report, which is about constitutional genetic study in familial lung cancer, familial history of cancer. This was outcome of our ongoing research question. We have taken up a project of doing genetic analysis, constitutional genetic analysis, not of the cancer tissue, in order to find the possible genetic variants which might have affected their cancer proneness. We all know about the carcinogenic exposures, right? But question always remains that not all smokers develop lung cancer. What is the answer? So the answer is in the genes. This is of course the hallmark of cancer cell itself. The arrow shows genetic instability and mutation. What if the normal cell already had the mutation? That will definitely increase the chance of acquiring cancer, right? And many mutations are already known, they are in the clinical genetic panel, but we do accept that there may be many more which are still not known. Not known because they are not studied, right? This is the textbook sentence that cancer pathogenesis is a multifactorial, multi-step process. This is the first line in any cancer popular article or book. So there are 4 quadrants, as we know. The A is that basic replication errors. C is better because we know the culprit and we might be able to avoid and do something about it. B is also very well worked out. We know Bloom syndrome, ataxia, telangiectasia, Fanconi's anemia, and all that. What about the D, interaction between environment and the genetic makeup of a person? So this graph shows that rare variants which have high penetrance, they are already in the genetic panels, clinical panels in which we study BRCA1, BRCA2, P53. We all know about all these famous genes. But then our focus is more on common variants and rare variants with low and moderate penetrance. So the proverbial thing is the tip of the iceberg we know, and there are many more to be uncovered. So genetic variants affecting cancer risk can be underreported, especially from our country, which is a mix of so many ethnic groups. And so if the total global data currently says that 15 to 20% are familial, I'm sure if Indian data was nicely compiled and added, the number will be very different. It will be much more than this. Do we have data regarding Indian data regarding incidence of familial cancer? I am here to get answer from the right audience. I am so happy that I got a chance to talk to the right audience, treating doctors. Maybe you would know, I of course Googled it and tried to contact our NCDIR, and this is the answer I got. They also agreed that it is important to know, but currently we don't have, there's no provision of collection of family history of cases. The incidence data is compiled, but family history is not taken into account. Why it is important? It is important because very few data, mainly available from South India, have shown some surprises that hereditary breast and ovarian cancer cases, they may or may not have BRCA1, BRCA2, the poster boy genes, but they had checked 2 in addition to BRCA1, BRCA2, or they had only MRE11, which means that the gene panels which we are using based on the Western data may not be exactly befitting to our needs. Our population might be having some other genetic markers which may be modifying their cancer risk. So there's a need for constitutional genetic analysis from various ethnicities, especially from India. Constitutional genetic analysis in cancer patients as well as their unaffected relatives. That can really give us some clue in a long run. Up till now, under this project funded by Nirma University from where I come, we have enrolled more than 20 families with a strong history of cancer, and about available members from 10 families have been studied using what is just discussed here, NGS. Yes, I could relate with many things discussed about NGS. There's a problem of too much data and how to interpret and whether to be overwhelmed with the data or just to cherry pick, and you always feel incomplete that we might be missing on some important genes. So I was sharing with madam who will be speaking after me. So this is the small summary of what we have observed, and let me share this case report which was published recently. The arrow shows the lung cancer patient who contacted us seeing our social media site that I have this family history. Please pay attention to these red boxes. These are all the cancer affected cases. 4 of them are no more. The person himself, who is also a surgeon, he gave his sample as well as his sibling sample. His progeny samples are remaining, and we are really looking forward to that because that will give us more information about the inheritance and pathogenicity and all. So what did we get from NGS data? These are the individual reports, but I will directly go to the summary of reports. Okay, so before showing you the PPM1D thing, these are some of the co-segregated genetic variants, and again the data of problem of too much data, and we found each and every variant is reported in one or the other cancer in different ethnic groups, but PPM1D was present only in the affected person, in the patient, and not in others. So this was the type of mutation which converts arginine with which replaces arginine with terminal codon. Let us understand a little bit about the gene. PPM1D sitting on chromosome 17q. These are the other AKA, other also known as other names of the gene, and if a person is born with a certain mutation in these are the, I have just shared 2 names of the syndromes which are, and many more are listed on OMIM. But we are interested in knowing that why we should take it as an important gene for carcinogenesis. This figure briefly shows that. The pink ones, ones are the ones which are negatively regulated by PPM1D. The green ones are the genes positively regulated by PPM1D. So if PPM1D is not normal, what happens is P53, which is responsible for ensuring that unless DNA repair is done, cell should not go into further cell cycle. This does not happen. So what happens is, in spite of DNA damage, cell goes on replicating, and as you know, that increases the chances of acquiring and fixing mutations, and that's why it is logical to consider it as a important gene playing role in carcinogenesis. If not driver, it is an important passenger mutation. It is reported as a driver in some of the brainstem glioma, and there are very, again, heterogeneous reports regarding role of this. I will skip this slide, but I will just share that this project we are doing in collaboration with computer science faculty. What we do is we ask for the raw data also from the lab, and we reanalyze the raw data to understand, to interpret the outcome and validate and see if we are missing on the given report. So these are some of the pipelines, and of course we are interested in the end product, that is the protein. What happens at the active site of the protein that we are trying to see. Universal gene panel is I think a trademark of one gene panel reported in some Western data, which has 81 genes. I have not shown all the genes here, but it does not have PPM1D. Again, emphasizing that the gene panels that we use should be custom made for our population. So if you remember Nirma for this, the statue shown here, please also remember as an excellent university which has many different institutes for engineering, life science, architecture, law, management, everything, and also funds a lot of research. I am thankful to the family as well as my collaborator and my research students. So these are the glimpse of the campus, and once again I share this thing to request you all to keep in mind the family history of cancer whenever any patient comes to you, and if there is any such strong history of familial cancer, kindly consider constitutional genetic analysis. If we are informed, fund permitting, we will also do that. Thank you very much.